My name is Dr. N.K. Singh. I am Director, Diabetes and Heart Research Center, Dhanbad, and also editor and admin of the India's most premier WhatsApp group, that is the CME India. My topic at the RSSDI Chennai yesterday was on the diabetic and COVID. As today, we hope that this epidemic is on the verge of vanishing, not vanishing at all, but it will remain, but it is believe not a big problem. But as you are aware that the diabetes with COVID is a huge problem, and some new updates in 2022 that is very important for the public and for the physicians both. We know now that once you get a COVID, suppose even it is mild COVID, now the new research has shown that in the long term you might be prone to or a risk factor for the diabetes. It is a huge problem that not only type 2 diabetes, but also data is emerging that even the type 1 diabetes that can increase in future. And although at present the correlation between the type 1 diabetes and COVID is not very clear, but it has been found it is more complicated and the new cases are being detected. In the same way, even the GDM prevalence, if you see, it has increased during the COVID time, and it is also now in the ascending trend. So this is a huge problem. So what my message to the physicians is that you take the history of the COVID in all your cases and tell them that you need a lifestyle modification, a constant monitoring and screening for the diabetes at least every 6 months. That is too much needed. And even someone has developed mild COVID, they must also be screened very frequently so that you can early catch up such cases and you can start the treatment of the diabetes. So one portion is that. And lastly, I will say that now it is also clear that almost all the drugs which we are using to treat a diabetic cases, if the patient suffers from COVID, then they were very much useful and you can use that, maybe the gliptins, even the SGLT2 inhibitors in the mild cases you can now continue. You can continue the metformin, you can continue pioglitazone. So it depends on the cases. So that is one thing, and the huge role of insulin, that is also very clear. So I think with this message I will end up here, that you must screen your cases. You take a proper history of the whether patient suffered from COVID or not, because these days when the Omicron wave, most of the cases they didn't get the rapid test done or even the RT-PCR. So even if something correlation is between the symptoms and the COVID, that must be screened and must be followed up. Thank you very much.